Hey everyone, this is Andrew Sauer coming to you from Kansas City. I'm really excited to be able to speak to the amyloid section of the guidelines today. As far as the approach to screening patients and diagnosing patients with cardiac amyloidosis, we have an update for patients who have suspicion for cardiac amyloidosis. And we need to point out that a high index of suspicion is necessary. And when we do, the approach is to first test for monoclonal antibodies, SPEP, UPEP, free light chains. And if we sense that is positive, ultimately moving forward with diagnostic tissue biopsy, with focusing on endomyocardial biopsy oftentimes for appropriate patients. Obviously consultation with hematology oncology, because for patients with light chain amyloidosis, the therapies have to do with treating the plasma cell dyscrasia. For patients who do not prove to have a monoclonal antibody, technetium pyrophosphate scanning is recommended when the index of suspicion remains high to help evaluate for transthyretin amyloid disease. And in the case where that turns out to be a positive test on technetium pyrophosphate, ultimately the recommendations are to proceed then with genetic counseling of the family members and to consider genetic testing for the patient and the family members. Tafamidis is now approved for patients with symptoms of heart failure, specifically NYHA class 1 to class 3, and regardless of whether they have a genetic or wild type variant of TTR amyloid. And lastly, as a class 2A recommendation with level of evidence C, but a very common sense recommendation, the authors are appropriately recommending anticoagulation for patients who have proven diagnosis of cardiac amyloidosis, but who also have atrial fibrillation. So in summary, screening for amyloid is important. Tafamidis is approved therapy for TTR amyloid. Genetic counseling and genetic testing is recommended, and anticoagulation for patients who have atrial fibrillation as well as cardiac amyloidosis is now recommended. Really great update for the Guidelines Committee.